What's up, everybody? Dr. Ranyan here. Today I'm with Harley. Harley is a coach based in Dubai. Today he comes in with left-sided medial elbow pain and left-sided shoulder pain, anterior lateral shoulder pain. So we're going to go ahead and get started. Today we're going to start with a neurologic examination and work our way up. When you're having pain in two joints on the same side, we have to consider a central origin. So something happening in the neck, potentially creating a sensitization or nerve irritation, which may result in the shoulder and elbow dysfunction. So let's get going. All right. Can you place your hands on your hips, please? Great. Hands, please. Can you feel this?
Yep.
Same both sides?
It's a little bit more numb on that left side. This, it's more.
You feel it more on the right.
yeah.
Here.
That's the same.
Here.
That's the same.
Here.
That's the same.
Here.
Ever so slightly feel it less on the left.
Left. Okay. Here.
Yeah, again, slightly less on the left.
Here.
That's okay.
Here.
Yeah, that's okay.
Okay. So this is why I like starting with the neurologic examination, because before we started filming, we went through Harley's case history. There was no mention of any numbness.
No.
Yeah. Okay. Can you squeeze my fingers for me? Go, go, go. Good. Turn over. Can you lift your fingers up?
Yeah, lift them up.
Yeah.
All right.
Okay, hold for me. Okay, make a fist. Lift your wrist up. Hold. Good. Hold. Do you feel the difference?
Slightly.
Turn you for me, please. Lift your wrist up. Hold.
That one's pretty solid.
Yeah.
Yeah, that one just feels a little bit less.
Feels just a
Unstable,
touch,
yeah.
yeah. Can you make a fist for me, please? I'm going to turn over, resist. Good. Other way. Turn over.
Yeah, we'll get a little bit
Yeah.
of pain in there.
This is on the top here
Yeah,
and there.
Yeah.
Okay, so let's go one more time. So you are resisting supination here. Okay, now let's resist pronation. Any sensitivity in the medial elbow?
No, not when I'm doing it.
Not when you're doing it?
No.
Okay. I'm going to push down, resist for me.
Okay, yeah.
Good. One more time. Again. There we go. And resist. Good. Now this side. Hold for me. I'm going to push down. Good. I'm going to push down. And again.
It's a bit of weakness there.
Yeah.
Yeah.
So you can see it all from the wrist all the way
Yeah.
up. Yeah. It's when we're grading it, I wouldn't say it's a 4 out of 10, but we would call it a 5 plus minus. Okay. So he's able to activate, he's able to resist, but you can feel that you kind of need a little bit more thought. Yes.
Yeah.
All right. Let's bring your arm up, bend for me. I'm going to push down, resist. Good. And then on the side. Bring your elbow in for me. There we go. And resist. All right. Relax. Can you look up for me, please? Any sensitivity in the neck?
Not so much. Maybe just like if I try and force it,
Yeah.
there's a little bit of like.
Where do you feel discomfort?
Just
Left,
at the lower,
right
yeah,
side?
just at the where
At the
my
base?
Yeah, at the
Okay.
base. Yeah.
Can you look straight ahead for me? Can you turn and look over your right shoulder? Any discomfort?
No,
Can you turn and look over your left shoulder? Any discomfort?
it's a bit tighter.
A bit tighter,
Yeah.
yeah? Look straight ahead for me. Can you bend your right ear to your right shoulder? Any discomfort?
Just a bit of tightness.
On the left side?
Yeah.
Okay, can you bend your left ear to your left shoulder? Any discomfort?
No.
None at all?
No,
Okay.
that's okay.
All right, close your eyes for me, please. Any sensitivity when I do that?
No.
Okay. Any sensitivity here?
No.
Any sensitivity here?
No.
Any sensitivity there?
Just at the back.
At the
No, just on the side that I'm crunching on.
left side?
Yeah.
Yes?
The
Okay.
right side, sorry.
Sorry, right side,
Yeah.
yes. When I push down, any discomfort?
Same again.
Same, right
Yeah.
side.
Yeah.
Okay. All right, leave your head loose for me. When I do this, any discomfort?
No.
If I do this, any discomfort?
A little bit here.
Right side?
Yeah.
Okay. When I do this, any discomfort?
That's not too bad, actually.
Not too bad. Okay. Let's get you to lift your arm up. I'm going to push forward. Resist for me, please.
Okay.
Go. Good. Lift up for me. I'm going to push forward. Resist for me. Great. Relax. Left side, please. I'm going to push forward. Resist for me.
Yeah.
So I think there we can very clearly
Yeah.
see the difference. Resist for me. Okay. All right, let's get both your hands forward, please. Lift up for me as high as you can go. Any discomfort in the shoulder?
Just a bit of tightness. That's it.
Front of the shoulder,
The back.
the back of the shoulder,
Yeah.
on the left side.
Yeah.
Yes? Okay, hands down for me. Right arm, can you lift up for me, all the way up? Yep. Any discomfort?
No, just my trap stopping it.
Okay.
At the top.
relax. Left side, up for me.
Same again.
Same.
Yeah.
No discomfort in the shoulder. Okay. All right. Can you externally rotate for me? Any discomfort in the shoulder?
Just a little bit of tightness.
Okay, and the same on this side. Any discomfort?
Same sort of thing, yeah.
Okay. Leave your arm loose for me. Any discomfort in the shoulder?
No.
Any discomfort in the shoulder?
Maybe just a touch at the top. Yeah. Just bringing it into the front here.
Okay. Any discomfort?
That's okay.
That's fine.
Yeah.
Okay. Let's test out your rotator cuff. All right. Leave your elbow loose. I'm going to push your wrist forward. Resist for me,
Yeah.
please. Good. Make a fist for me. I'm going to push down. Resist for me. Good. Relax. Here. I'm going to push forward. Resist for me. A little bit weak, eh?
Yeah. I
Okay.
can feel that.
Make a fist for me. I'm going to push in, resist for me. Any discomfort?
That's okay then.
That's okay.
Yeah.
Relax. One more time. Make a fist. Go. Any discomfort?
No, that's pretty solid
Okay,
there.
good. All right, let's check out this shoulder. Leave it loose. Any discomfort here?
Just getting there.
Okay.
Yeah.
In the front of the shoulder.
Yeah.
Make a fist for me, point your thumb up. I'm going to push down, resist. Good. And then come in here, thumb down, and resist.
Yeah. There's a bit
Sensitive.
there. Yeah, just in
Okay.
that front joint.
All right, relax. So what I'm doing, guys, is just going through a sequence of assessments. We did neuro, we did cervical, range of motion and orthopedic testing, some muscle testing related to the neck, and then I move into the shoulder. Now we're doing shoulder orthopedic testing. So I'm trying to get an idea of what's irritated in the shoulder. I've established what's irritated in the neck. I'll explain that to you in a little bit. Leave your arm loose. Any sensitivity here?
No, that's okay.
That's okay,
Yeah.
good. Make a fist for me, point your thumb up. I'm going to push down, resist. Any sensitivity or just
Just in
weak?
the elbow. Just down there, down the bicep.
Down the bicep,
Yeah.
okay. Turn in for me. I'm going to push down, resist.
Yeah.
Any sensitivity? No,
No.
okay. Thumb down for me. I'm going to push down, resist.
Yeah, it's a bit there. in
A
the
bit
front of the
sensitive.
shoulder, yeah.
Okay. So let's do a little bit of a poke and prod. So you are most certainly going to experience some type of impingement syndrome.
Yeah,
Yeah.
I think that's probably
Yeah.
the case.
That's 90% of bodybuilders. I'd probably
Yeah.
even say 100% of bodybuilders, right? The question is what's irritated? Is it the bicep tendon
Yeah.
or is it the supraspinatus tendon?
Right.
Okay. Let's get your hand on your hip for me, please. Okay. So let's start off here. Sensitive.
Yeah.
So that's bicep. Let's work our way here. Sensitive.
Yeah, different kind of sensation though.
Sharper, duller,
Yeah, sharp.
more
It's a bit-
achy.
I can tell it's there. The other one was more so like,
Just a palpation, just a
yeah,
pain
I
with,
can feel it.
with pushing on it.
Yeah, it was like translating downwards into my
Yeah.
elbow. The second one was more so just directly where you were pressing.
Okay. All right, so this is rotator cuff. Any sensitivity? Which one would you say is most sensitive?
In terms of nerve pain, the first one that we did.
This
yeah,
one here?
that
Okay.
one's more so nervy. The other one's just more so like a pressure.
Okay. Let's check out the elbow now. We'll start with this side. Okay. Make a fist for me. Sorry, just flex and extend your wrist. Any discomfort
No,
in the
that's
elbow?
okay.
So flex
Yeah.
and then extend the elbow and the wrist. Yep. Any discomfort?
No, other than just that I trained yesterday.
Okay. What did you train yesterday?
Trained pull. So
Okay.
there's probably yeah, a little bit in the elbow. Just that
Anything?
last little bit, just in this area
In
there.
that area.
Yeah,
Okay. Okay.
that's the only place.
Make a fist for me. Lift up. Nothing in there. Eh?
No.
Straighten the elbow for me. Make a fist. Hold. Any discomfort?
No, that's
all
fine.
right. Turn your wrist in. Resist. Any discomfort?
No.
No. Okay. Same on this side. Please flex and extend the wrist. Just keep your there we go. Elbow at 90. Flex and
here.
extend. Just flex and extend here.
Okay, sorry.
Any discomfort?
No.
No.
Maybe
Okay.
a little bit in the bicep.
And let's get you to go.
Yeah, it's just starting to go there. That last little bit. Yeah. Just in that joint there.
Down here.
A little. Yeah, just in there. That's it. Yeah. Yeah, all the way around there. That's okay there.
So that
That's-
would be
Yeah. A bit
your
higher.
common flexor tendon. You are feeling it more anteriorly here.
Yeah, there.
Okay. Any sensitivity when I do that?
Just the same place as before.
Same place as
Yeah.
before. Okay. Bend your elbow for me. Make a fist. Lift your wrist up. Hold. Any sensitivity?
No.
Okay. Straighten it for me. Make a fist. Lift your wrist up. Hold. Any sensitivity?
It's just starting to when there's a little bit more additional pressure.
On the inside of the
Yeah.
elbow. Okay. Bend your elbow for me. Make a fist. All right, come in. I'm gonna resist. How does that feel?
That's okay.
That's okay.
Yeah.
All right, let's get you on your back for me.
Perfect.
Okay, so thus far, what do we know? From Harley's loss of range of motion in his neck, the numbness in his finger, there's possibly something happening in his neck, something going on there. Maybe all of this is starting from the neck. There's definitely some type of impingement syndrome in the shoulder and there's discomfort in the elbow. I'm not quite convinced it's a medial epicondylitis or a golfer's elbow. There seems to be some bicep tendon involvement as well, but we're going to continue examining him and see what we can find. You haven't had any bicep tendon injuries, eh?
No, touch wood. Touch wood.
Okay, good.
Everything's been okay.
Sensitive.
No, it's not too bad. That's just a bit nervy. Similar feeling. That's a bit nervy. The pressure feels weirdly nice, if that makes sense.
Yeah.
That's a little bit more tender getting towards that area.
Yeah.
there. Yeah, and then Yeah, a little bit more there. Bit there. Yeah, there we go. That's around that area there, yeah.
This is not necessarily where you feel your pain though, right?
I would say on the pulling movements, underhand, yeah.
This is where you feel it?
Yeah.
Okay. But on the push movements,
Shoulder.
shoulder?
Yeah.
Okay. On tricep movements, push downs, more medially?
Yeah, more on the outside. That's
Okay.
Inside, sorry.
All right, while we're here, let's test out some of your muscle strength. Turn your wrist in for me, please. I'm going to pull away. I'd like you to push towards your hip. Go for me, please. Good. Turn your wrist in for me. Push across. Go. Good. So that's your pec major, which we did second, and your lat, which we did first. Here we'll do lat. Push towards your hip. You had an ACL reconstruction?
I did, yeah.
Okay.
About 9 years ago.
Okay. Push across for me, please. All right.
Yeah, that's
You can see the
yeah.
difference, right? Okay. Let's continue palpation of your elbow.
Okay.
Can I get you to lie face down, please?
Like dry needling and things like that.
Is that your off-season time generally?
It's more so around when my clients are competing or
Okay.
photo shoots and things like that.
Okay, so tricep, any sensitivity?
A little bit there, yeah. That's it there.
Sensitive?
That's not too bad.
Okay. Let's start making our way down here to the common flexor tendon.
That I can feel down before.
Sensitive
Yeah,
here?
that's very sensitive, yeah. That's all the way down to my wedding finger.
But this is only sensitive when I push on it. It's not sensitive during exercise, yes?
No, not as far
Okay.
as I'm aware, no.
Down here?
Just sensitive when you press.
Just sensitive when I press. Okay. Okay. Let's have a look at all the other musculature. This morning you had some soft tissue work done, yes?
Yeah,
Okay.
nothing crazy, just a flush, which is what I normally have.
Any sensitivity here?
I can feel it, yeah.
Yeah?
Yeah.
You got a nice trigger point there in your tricep. Okay. Let's get you to put this elbow back on. Okay, so not only is Harley here for his elbow and shoulder, he's also here for some MOT. So we're going to do a quick spinal screen and see what his spinal alignment is like. All right. Any lower back pain?
Ever so slightly there, yeah.
Any history of lower back pain?
Yeah.
Which side?
I would say overall, just anything flares it up.
Okay.
I've never
General back pain.
yeah,
Okay.
like, I've never really been able to hip hinge or deadlift or anything like that.
Okay.
Probably because you built like a brick.
Yeah, exactly. I'm very, very tight. You'll probably find that out.
Let's get you to raise your right leg from the hip, please. From the hip.
Oh.
Yeah. As high as you can go. Okay, and down. Left leg. And down. Okay, so we've got a short leg on the right, but a positive passive hip extension test on the left. So the hip extension test is a nice test to distinguish between sacroiliac joint dysfunction and a facet joint imbalance at L5-S1. So here we have, let's go here, L4. We have a dysfunction at L5 and we have a short leg at PSIS. Okay, let's have a palpation here. When's the last time you got adjusted?
Oh, a long time ago.
Yeah? So
Yeah.
you're going to give me problems today, right?
We'll,
I think
we'll
so.
see, because
Yeah.
my partner stands on my back just to get some release.
You're pretty jammed up here, but I would say. Any sensitivity here?
A little bit,
Here?
not too bad. The upper back, the pressure just feels quite relaxing. And there.
All of this is locked up. Let's have a look here. Sensitive?
It's not too bad.
Sensitive when I push on there?
No, that's fine.
Sensitive when I push on there?
No, that's okay.
This one feels jammed. Okay. Any sensitivity when I do this?
A little bit on the left.
Any sensitivity when I do this?
Same again, a little bit on
Left.
the left. Yeah.
Any sensitivity here?
It's the same both sides, it's just a bit. Just,
Here is left side,
yeah,
in there.
yeah.
Not so much there, eh?
A touch when
A
you
touch.
do that individually, yeah.
All right, you want to sit for me, please? Okay, guys, so we just finished up with assessing Harley. There's a lot going on, but not much at the same time. There's no orthopedic tests that provoke his medial elbow pain or pain on the inside of the elbow. There's no positive golfer's elbow tests. So what I think is happening is he has a nerve sensitization or nerve irritation in his neck on the left side. And this is causing muscle inhibition of the shoulder, and the overload on the shoulder is creating a biomechanical change in the elbow, which is triggering his pain and overload. I actually think that most of his discomfort is coming from the short head of bicep tendon and radiating over the inner aspect of the elbow, because his most provocative exercise at the gym is a pull, single arm pull, yes?
Yeah, and a bicep curl now, I'm
Bicep
thinking
curl.
about it, yeah.
There we go. So that's what I think is going on. So what we're going to do is we're going to improve his biomechanical function by firing up all the muscles on the left side. We're also going to do some work on his neck, probably some decompression and some intramuscular electrostimulation there, so we can get the nerve root fired up where the problem is starting, I suspect. We're going to reassess his muscle strength, and then we're going to go from there. Probably end with some manipulation. All right. If you like what you see, please hit the like button, subscribe, and if you have any comments, drop them in the comment section. You ready to go, man?
Of course.
There we go. So when we met at the gym, you spoke about dry needling.
Yeah, I've had it previously,
Yeah.
just on the elbow. But that was, yeah, when I was back in the UK. I've not had any since I've been
Since
here.
then, when were you back in the UK?
Last year?
Last year.
Yeah,
Okay.
so October.
All right. So, how I like to work is I prefer to improve biomechanical function and neurologic function before I dive into the area of pain.
Right.
Sometimes, often patients find great relief when you jump into something like dry needling immediately as a means of pain control. But we don't really fix the problem, or we may not fix the problem. What I want to do is fix the problem so that when we start treating that area, we have a better success rate of the problem not occurring a second time.
Got you.
So we've done a whole lot of muscle testing. And basically what that tells me is which nerve roots may be affected.
Okay.
And which nerves may be affected. Now what I'm going to do is use the concept of dry needling to target those nerves and use an electrostimulation to fire up those muscles. Have you had this before? Or had electro needling before?
No, I haven't actually,
No.
so it's going to be a new experience for me.
There we go. And you're one of the first big guys that I've treated that didn't squeal when the needle went in.
I didn't even know it went in, to be honest.
You better hope that's not what she says. So you'll feel an impulse.
Yeah.
Okay. I'll progressively increase the intensity
Yeah.
of the impulse.
This feels like a bit of a gnat bite.
You good?
Yeah.
So how long have you been in Dubai for?
So we first came over during COVID.
Okay.
December 2020 we actually came over, and then we were on and off. Well, we were actually here for 6 months before we decided that we wanted to move here. One, because we couldn't go home. Two, because there was not much point with it still being in lockdown. Purely the reason that we purely came over was because of the gyms, and then just sort of went from there really.
You just came over to train, not necessarily to train clients.
No, so I was solely online at the time.
Okay.
So it was just more so we could train and obviously live a bit more of a normal life than lockdown in the UK. And then we pretty much sold everything in the UK, and we've been here permanently since 2022.
Nice.
But on and off for 4 years. What about yourself?
Yeah, I also came during COVID.
Yeah.
I was stuck in lockdown in an island called Mauritius.
Okay.
I was doing my orthopedic specialization there,
Yeah.
and it was coming to the end. I had signed a contract extension. In fact, it would have had me there until this year, April.
Right.
But when lockdown hit, it was like that movie Castaway.
Oh, no one there. Yeah.
Stuck on an island, nowhere to go.
Yeah.
There's only so many times you can drive from north to south, east to west. So, I was lucky enough. I got an opportunity in Dubai, and I came over.
Not looked back since.
No, man. It was tough starting off because my style of chiropractic is a little different to what people are used to here.
Yeah.
My area of expertise is also different. I don't focus on chiropractic manipulation as my primary form of management.
Right.
I like working on complex cases,
Yeah.
specifically disc-related or tendinopathies, tendon injuries, which is not what the market was interested in at that time.
No.
Especially when you go to see a chiropractor. So I had to, kind of just persevere and create my niche.
Of course. It takes time though, anything like that takes time.
Yeah. Do you feel that?
Yeah, it's just starting now.
So this is your dorsal scapular nerve, and it's what supplies your rhomboid minor and major,
Right.
together with your trap mid and min. Man, the amount of muscle bulk on you, I got to use longer needles.
I was going to say, it's very subtle. That was very subtle.
Okay, so that was a 4 centimeter needle. I think for the axillary nerve here, we're going to have to use a 5. How's that?
It's very faint.
Now.
Yeah, I can just feel that. There you go. That's it. Yeah, there you go.
So you train all your clients out from Binus?
Yeah. So all my face-to-face. Well, I only have a handful of face-to-face, which I do at Banus, and then the rest are all online.
And you mentioned you were trying out some new gyms.
Yeah. So I've been at Banus since we moved here, and
Bring your arm up for
I think
me.
just
Yeah.
a change of scenery for a while was in order. So just been trying out a few different ones. I've been over at Wellfit in Maidan,
Yeah.
which actually used to be Max and Eagle, and enjoy that gym over there. So been training there.
This is your lat, okay?
Yeah,
You're going to probably get a big pull here, like you're doing a lat pull down.
yeah, I can feel that. It's a weird sensation.
Not painful though, right?
No, not painful
Okay.
at all. It's when you used to have those muscle machines that used to put the sticky pads on.
Yeah, tens.
Yeah,
So this is basically utilizing the concept of tens, right?
right.
But what we're doing is instead of passing the impulse through receptors on the skin, we're going directly to the nerve.
Right.
So, you know, there's no timeline which has shown to be more effective when using tens on muscle activation. 10 minutes, 15 minutes, 20 minutes. Which is because I think the stimulation gets lost. You're going to feel this in your bicep, okay?
Okay.
How's that? Not too
I can
strong?
just feel that in my shoulder.
Yeah?
Yeah.
You will feel it probably where my finger is touching you, yes?
Where are you touching?
Here.
It's a bit lower.
So that's your long head or bicep
Yeah,
tendon
I can feel that.
insertion.
Yeah. Yeah.
This is your musculocutaneous nerve, which supplies the bicep.
Yeah.
Okay. All right, let's get you on your back for me, please. Okay, we'll work a little bit more on the bicep now. How's the sensitivity in there?
Yeah, it's a bit there.
Yeah. Okay. You good?
Yeah.
Okay, we're gonna start off nice and slow.
It's just picked up.
So this is short head.
Yeah.
Okay. Not too strong?
That's fine.
Great. And we're going to do the insertion. Any sensitivity?
No, it's
No.
okay so far.
Are you training today?
No, rest day today.
Nice. How many days do you train?
Just 5 days, and then 2 rest days per week. One on a Wednesday, one on a Sunday.
Okay, so
Which
it's kind of
works.
middle and end.
Yeah. I never train more than 3 days in a row,
Yeah.
ever.
That's good, man. Actually, Andy Bell made me aware of that.
Yeah, it's very common. Like
Yeah.
for a lot of people to train more than
Man, some people are
5
training
days a
6
week,
days,
6
7
days a
days.
week in
Yeah.
a row.
All right, let's get you face down, please. Once I started to train in a split like that, I noticed that my recovery was
Yeah.
better.
Yeah.
But not only was my recovery better, I stopped picking up small niggles.
Yeah. I think you do definitely see a dip in performance and a dip in recovery after that 3rd day. I think some people that are training like upper lower, where you're obviously having that break in between, so doing like upper lower,
Yeah.
lower, it may be okay. But generally speaking, I think if you're doing like a push pull leg split or something like that, definitely need to have that rest. And if I find if you're not after that 3rd day, then you probably need to look at your training intensity on those 3
Yeah.
sessions.
You're probably not going as hard as
Yeah,
you should.
Exactly.
How did you do your ACL?
Playing football. Yeah, playing football. Typical UK football pitches, not very
Yeah.
good.
Who's your team?
I don't actually follow it
Okay.
anymore, you know. I used to play at a high level when I was a kid,
Yeah.
and then I sort of dropped off and found other sports, and then I'd revisit it again when I was like 19, 20, and then played a full season, actually got back into the swing of things fairly good, and then last game of the season ended up snapping my cruciate ligament. I've never played since.
Oh,
So yeah, that was a tough year.
what year was that?
What am I, 30 now? I'm 30 now, so I would say it was about 9, 10 years ago.
Okay.
Yeah. Maybe a bit longer. So I would have been, what would that be?
How was the process?
Of
Recovery.
recovery. Slow. I was a manual labour
One
job,
second.
so
Can we get this arm behind? Can you do that?
yeah.
Oh, that's pretty good. Okay.
Yeah, so
You were tradie.
Yeah, so I was doing roofing on houses. So
Yeah.
they
That
put
one
me out
must
of
have been
work.
very tough,
Oh,
yeah.
16 weeks I think I was out. But typical NHS, it took me, well, saw a specialist, had an MRI very quickly, and then took it to the NHS, and 9 months it took for me to get the operation. By that point, I'd already like almost recovered as such, where I was able to just do like normal day-to-day stuff, and then then had to go through the whole rehab process again. I think it took me probably 4 or 5 years to get my leg back to a similar size.
Yeah, man. That is the problem with public healthcare, right?
Yeah, I know.
Your surgery was probably not a priority for,
Oh no, definitely not.
you know,
Definitely not.
in the grade.
Should have gone private, but at
In
the
the-
time, you don't think.
And you've made a full recovery now?
Yeah, so I have no issues with it, touch wood again. I have to be a little bit careful. Over here it's much better because you're not subject to the colder weather.
Yeah.
In the UK, obviously the winters where they are very cold in the gyms, like warming up protocols were more extensive. Whereas here, like, as long as I've got a bit of blood flow in and do
You're
some
ready to
warm-up
rock and
sets,
roll,
Yeah,
yeah.
pretty much.
Okay, so I'm just gonna do some work on your neck as well.
Okay.
See, no, your skin's too thick. The thin needles are not working. Okay, let's try that again. There we go. It's not too bad.
No, it's okay.
Okay, come back to that one. So are you going to compete this year?
I'm still undecided. I've got a photo shoot booked in April with some clients back in the UK.
Okay.
And then, depending on what condition I get into and what I'm looking like, I'll decide from there. I had a bit of time off last year. I think it was just needed, just to sort of recuperate and get the love for the sport back.
Back, yeah.
Sometimes when you've, well, especially been invested in it for the last several years, a bit of time off is definitely needed sometimes.
Yeah, going through the whole cutting process to compete is tough, man.
Yeah.
I don't know how, I really don't know how fighters do it 2-3 times a year, that whole training and cutting down process.
I
It's
think
tough.
if you treat it like a job, which they do,
Yeah.
obviously it's slightly different, but equally I think like it really depends on the kind of person. Like I've learned over the years that a lot of people around you have to make sacrifices as well.
Yep.
It's not obviously just you, so sometimes filling up your cup and their cup is needed, and I'm under the impression that like I'm willing to sacrifice 1 to 5% of my progress to have a little bit more flexibility, because I know in the long run, over years, that will allow me to be a better bodybuilder and
Yeah.
obviously do this for longer periods of time. So where some people do go wrong is that they go all in and then they come all the way back out very, very quickly because they don't have that flexibility. There's a handful of people that I know that can live that all-in bodybuilder lifestyle for years and years and years, but I would say majority of people having a bit of flexibility is definitely needed.
Can you feel that?
Yeah, I can feel that.
Light, mild, or strong?
It's pretty mild.
Pretty mild.
Yeah.
Okay. How's that?
Yeah, it's a bit stronger.
Okay.
More so on the right than the left.
Yeah, your left is struggling to get going. How's that on the? Is it more equal now?
It's just the left I can feel now.
Now?
Yeah, that was a bit more even.
Okay. All right, 5 minutes,
Yeah.
and then we will reassess your shoulder range of motion and strength, and we'll do some manipulation.
Okay.
Okay. So what we will be looking for is less discomfort
Yeah.
by 10 to 20% on bicep curls and your pulling movements. Okay, if we have a complete reduction in pain, that will be insane. Okay, but we're going for 10 or 20% because it's something that's been there for approximately 12 weeks. By focusing on the bicep at this session, I can start to use a system of exclusion to narrow down what's uncomfortable or what's in discomfort. Okay, there may be multiple structures. It may be one structure that's very mildly irritated or inflamed at the moment. Okay. Okay. Can we get you to look up for me, please? Any sensitivity in the neck?
Just a little bit on
On the right side.
Also going down into the trap.
Here.
Mid trap.
Here.
Yeah.
Okay.
There.
Look straight ahead for me, please. Can you turn and look over your right shoulder? Okay. Can you turn and look over your left shoulder? Any discomfort?
No.
Okay. All right. Let's test range of motion. Can you lift up for me, please, as high as you can go? Okay. Down for me, to the side, and up for me, please, as high as you can go. Go, 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 go. So your range of motion is better, right? Yeah. Okay. Any discomfort now when you go up? No. Okay. Let's do some muscle testing. I'm going to push forward. Resist for me, okay? You're going to push back. Go. Go, 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 go.
A little bit in the back, not as much.
A discomfort.
A little bit.
Yeah. But you feel how you can lock out now.
Yeah.
Hold for me. I'm going to push forward. Resist. Great. Hold for me. Make a fist. I'm going to push forward. Resist. That's much better. Okay. Pec major. Pec. Let's actually check out your wrist as well. Same or different?
It's got better.
It's got better.
Yeah, but it's still obviously a little bit more numb compared to that side.
That side. Okay. Make a fist for me. Lift your wrists up. Actually, we just need to do this one. Lift up. Hold. That's much better. Make a fist for me. I'm going to turn in. Resist. Sorry. Don't extend the wrist.
Okay.
You're going to supinate.
Right.
Okay. Go. Go, 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 go. Any discomfort?
A little bit after, but not.
Where?
Just on the other side.
Inside. Okay. Let's go one more time. Go, 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 go.
No, that's fine.
Fine?
Yeah.
Okay. Hold for me. I'm going to push down. Any discomfort?
Just a little bit in the bicep.
Just a little bit in the bicep. Distal, yes?
No, it's a bit further up, so it's just actually in the bicep itself.
And the muscle itself. Okay. Let's get you on your back for me, please. All right. Let's check the lat. Turn your wrist in for me. Push towards your hip. That's much better. And then push across for me, please. That way, yes. Go. Go, 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 go. Much better. Okay. Let's get you to turn and lie on your side for me. Lift your head up. There we go. Let's do some manipulation. So what we would do is we look to see what your discomfort is like when training.
Yeah.
And then at your next session, we'd reassess muscle strength to see if all these changes that we made today stick.
Yeah.
If they have stuck, we'd start working specifically around the medial elbow.
Yeah.
Start getting into those muscles, either with dry needling, shockwave, or intramuscular electrostimulation.
Okay.
If it hasn't stuck, we would go back in and do a second round of electrostimulation. Okay? Because it means then your body is fragmenting.
Yeah.
Yes, your motor control patterns can't stick.
Right.
So no matter what we do to fix the area of pain, it's going to come back.
Yeah, of course,
Come down for me, please. Can you shift down a little bit? There we go. Let's bring this with you. Can you bring your hips to the edge for me, please? All right. What's your weight?
I was 110 kilos this morning.
110.
So two,
Damn.
240, over 240.
Yeah. I was 110 some time ago, but I definitely didn't look like you.
I've actually lost some weight, you know. I've lost about 6 to 8 kilos.
Yeah.
Yeah.
I wish I looked like you when I was 110. Look like a bean cushion. Okay, hold. There we go. All right. Let this knee roll for me. Roll, 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 roll. Inhale. Oh, there we go. Inhale, exhale. That went before
Yeah,
we even. Let's get you on the other side, please. Come to the edge for me, please. There we go. That's a good setup. Hold for me. This arm through here. Oops. Hands there. All right, let this knee roll. Roll, 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 roll. Inhale, exhale. There we go. You good?
Yeah.
On your back for me. Sit, please. Sit, sit, sit. Okay. If you compete this year, what would you compete in?
I don't have a choice. I'll literally be in super heavies, and that's it.
Oh, super heavy.
Yeah, super heavies. Unless I can get under 102 kilos, then I'll be in light heavies, which would be.
Elbows together. I got you. There we go. That's a nice one. Now bring it back. Relax. I got your arm. There we go. You good?
Yeah.
When's the last time you've been hugged by a man? It's been a while.
Yeah, a little while.
There we go. Okay. Leave your neck loose. Loose, loose, loose. Ooh, ooh, ooh. There we go. You good?
Yeah.
You good?
Yeah.
All right. Let's get you up. Sit for me. Swing your legs over. All right. Let's do one last assessment of this medial epicondyle. Make a fist for me. Okay. Relax. How's that?
Yeah, it's better.
Any sensitivity?
A little bit, but it's much better than it was.
Okay. Can you pull? I don't think I'm going to provide much resistance, but let's see if you pull. Pull.
Oh, like a
Pull.
rope.
Yes.
A little bit still there, but not as bad as it was. Yeah, we're okay. Yeah.
What do you find the discomfort has come down to?
Yeah, it's definitely more than 20%.
Yeah.
Yeah. And I think more so, the more I would do it, once there's a bit of blood flowing,
Yeah,
there,
yeah.
and obviously the muscles are firing, it'll probably be less.
Okay. Great. All right. So that brings an end to our session today, guys. It was a long one. We covered a lot of different stuff on Harley. This is a very interesting case, and look out for part 2. Harley, do you want to share where your details, where our
So you
viewers
can
can
find
find
me
you?
on Instagram. I'm Harley_Judge. Give me a follow on there. YouTube, I will add into the comment section below, or description box, sorry, and then you can find me on there. I've only just recently started posting again, so just have to bear with me, but videos will be coming.
There we go.
From next week.
Guys, go ahead and subscribe to Harley's channel for those of you who are looking for training tips and want to get fit. Thank you very much for watching, and we'll see you soon. Take care.